Hello, everyone, and welcome to the 2020 inaugural Injury Prevention Center Symposium. I'm Patrick Carter. I'm the director of the University of Michigan Injury Prevention Center. I want to thank you all for joining us today. As many of you know, we had planned to have this event live and in person in March, but had to cancel due to the COVID-19 pandemic. But we're really happy and excited that we were able to take advantage of technology and still have this planned event and keep everyone safe. Although we really miss getting to see everyone in person and have the opportunities for networking that an in-person conference allows, I know that today's event will still be a really great opportunity to share the work of our center and may even allow us to reach colleagues that we don't normally reach. I'm really excited that we have more than 500 people registered to join us today virtually to hear from our outstanding faculty researchers across our center and to engage with over 50 researchers across the world who will take part in our poster session. In fact, at our last count, we have attendees joining us throughout the day from over 26 states, 11 countries, and 227 academic institutions. So we welcome you all today to work with us and share our evidence-based solutions to prevent injury throughout the nation and across the world. Before we get started, I wanted to give you a little bit of background about our center. The University of Michigan Injury Prevention Center is one of 9 CDC-funded injury research control centers across the nation that together address urgent injury-related issues with research, education, and outreach. And we seek to advance injury science through research that identifies evidence-based solutions, outreach that provides technical assistance to our partners in state health departments as well as community partners, and to disseminate and translate evidence-based research into practice, as well as advance training of the next generation of injury prevention researchers and practitioners. The mission of the Injury Prevention Center is to conduct, translate, accelerate injury prevention research into practice and policy to reduce the burden of injuries across the Great Lakes region as well as the United States. We have over 1,000 members from 35 institutions and faculty leadership from more than 14 departments across the University of Michigan. And that our center brings together many disciplines that focus on injury prevention. We cover a lot of different topics in injury prevention, but we have a few focus areas that I'd like to highlight: opioid prevention and overdose prevention, suicide prevention, youth violence, concussion-related research, motor vehicle crash injury prevention, older adult falls, as well as the prevention of adverse childhood events and other emerging areas that we focus on. Before we get started today, I did want to highlight a couple of resources that the center has. The first, we have 2 massive open online courses. The first one that I'd like to highlight is our course on injury prevention for children and teens. This is a large multidisciplinary course that covers many different focus areas in childhood injury prevention and is applicable to fields including healthcare, kinesiology, public policy, social work, pharmacy, dentistry, and psychology. And the educational content that we have in this course is appropriate for a wide swath of both the general public as well as injury practitioners and researchers. And the course can be taken both linearly, you can go through each of the different sections of the course, or if there's a specific focus area that people have an interest on, they can proceed down one of the branches in the tree here that you can see on the right side of the slide. The second massive open online course, which is our newer addition to our educational offerings on the website, is called Impacting the Opioid Crisis Through Prevention, Education, and Practice for Non-Prescribing Providers. And this course focuses on opioid overdose prevention and prescribing practices. Both of these courses together offer free AMA credits for physicians and nurses, and the opioid course also offers additional educational credits for social work and pharmacy. You can find out more about these 2 courses on our website, injurycenter.umich.edu. And I encourage you to go there to look at the courses and go through the content as you like. I did also want to highlight that we do have a membership program, and I invite everyone who's attending the conference today to become a member of our center. The application is very quick, and becoming a member is free. It gives access to all of our regular communications, including our newsletter, funding opportunities, upcoming events, such as the event we're having today, as well as the latest on our research output and news. To become a member, just go to the website or use the QR code here on this page, and it will take you directly to the membership application. Next, I did also want to highlight and take a minute to highlight an upcoming event that we have in the spring of this year, which is a Suicide Prevention Research Summit, which is designed to share the latest evidence-based research in the field, facilitate new collaborations in research, and explore new ideas for suicide prevention and understanding. The symposium will be virtual, and it's going to be held on Tuesday, March 16th from noon to 5 p.m. Eastern Standard Time. I encourage all of you who are attending today to go to the website and sign up and attend this event. I think it's going to be a great event. We have speakers coming or presenting nationally from around the country who are leading experts in the field. And I hope everyone will attend the event. Before we begin, just a couple of housekeeping items about the agenda for the day. So you can see the agenda here as well as on the website. First up, we'll have some opening remarks from our founding director, Dr. Rebecca Cunningham, followed by our first series of presentations of flash science by leading researchers at our center, followed by a keynote address by Dr. Amy Bonhart. This will be followed by a second session of flash science presentations by leading experts at our center. And then following that, there will be 6 concurrent poster sessions. And you can see the links to the poster sessions below the live stream on your screen currently. This will be followed at the end by some closing remarks. The entire day will be live streamed on the website, but it will also be recorded. So if you miss a session and would like to go back and see a session, we will post that on the website. I also would direct you to look at the program brochure that's also available on the website. It has biographies of all the speakers who will be talking today, as well as information on the resources that I reviewed earlier and other resources that our center offers, and a list of the poster abstracts. Just a reminder, if you do have any technical difficulties, please do reach out. We have an email that will be monitored all day, the U of M Injury Center at umich.edu. And please email us if you're having technical difficulties, and we'll try to address those as quickly as possible. And lastly, I did want to say we will be sending out an evaluation after the event. This is our first virtual conference here at the Injury Prevention Center. And so we do want to get feedback from everyone on what went well and what we could do better next time as we continue to work through these challenging times with these virtual conferences. And now I have the great honor of introducing Dr. Rebecca Cunningham. Dr. Cunningham is the founding director of the U of M Injury Prevention Center. She has a distinguished research career in researching intentional injury and violence and substance use prevention, including opioids, particularly among youth and young adult populations. She has developed and applied behavioral interventions in emergency department settings, as well as other healthcare settings. She currently serves as the Vice President for Research at the University of Michigan, the William G. Barson Professor of Emergency Medicine in the Department of Emergency Medicine at the Medical School, and a professor in the Department of Health Behavior and Health Education at the U of M School of Public Health. As a senior advisor and director emeritus for the University of Michigan Injury Prevention Center, she continues to provide us with vital support to our center leadership and guidance on the short and long-term missions of the center. Please join me in welcoming Dr. Rebecca Cunningham.
Thank you, Dr. Carter, and thank you to everyone who's joining us virtually this year for our annual Injury Prevention Research Symposium. I also want to especially thank Dr. Carter, Walton, and Jessica Roche for leading the center through this really difficult time over these past 8 or 9 months with such grace, while often managing the front line of the COVID epidemic concurrently. As the center starts its really second decade here of CDC funding, your leadership, I know, will aid us in our focus on injury prevention. So thank you. As Dr. Carter mentioned, I'm the Vice President for Research here at the University of Michigan and the former director of the IPC, and it's my pleasure to welcome all of you to what I know will be an incredibly informative and engaging research symposium. As an emergency physician and academic researcher, I have devoted about 20 years of my career to focusing on these important evidence-based injury prevention research topics, particularly in the fields of firearm injury prevention and opioid overdose prevention. There was a time when a science on injury prevention didn't generate so much attention, and I am just so thrilled to see the progress that our center has made, as well as the enthusiasm of those across the country and the world interested in joining us virtually today and the coming of age really of this topic. It's truly a silver lining of COVID that the barriers to convening virtually have been lowered, and we will take whatever silver linings we can get in this age. I'm really thrilled that so many of you submitted abstracts that will be presented during our virtual poster session this afternoon, and look forward to seeing some of those and hearing the important injury prevention research cutting edge that is being led not only across the country, but also internationally. We will learn from each other today. As many of you know, the first half of life, more Americans die from violence and injuries, such as motor vehicle crashes, falls, or homicides, than from any other cause, including cancer, HIV, or the flu. This makes this the leading cause of death among people between the ages of 1 and 44. Gun violence alone continues to leave us a devastating impact on our communities and across the United States, with more than 100 people continuing to die each day from firearm-related injuries. And then in this time of COVID, those curves are going up. However, most of these injuries are both predictable and preventable through evidence-based solutions such as we will talk about today. We all play a vital role in addressing injury prevention, and I'm excited that we will have a diverse audience composed not only of our researchers, trainees, and students, but also of practitioners who are working on the front lines of public health across the state and nation. The injury prevention research and practitioner community is strong and full of amazing people who have dedicated their lives to making their communities safer and healthier. And it is this partnership of research to practice that makes the Injury Center and the CDC focus and goals really so marvelous. These are indeed challenging times, not just as it relates to our personal lives, but also in our professional lives. It's a time where public health and prevention is more visible than ever in our daily discussion of masks. It's also a time that feels familiar to many injury researchers, where evidence-based science and prevention is politicized. Our community, I think, can aid in this discussion of prevention by offering examples of other injury prevention and public health science that was also political. One need look no further than how political it was to introduce seatbelts in the 1960s or 70s, to the controversy over the basic facts on how many gun deaths there are each year in recent decades. Our injury prevention community with public health is poised to aid in cutting through the noise and helping the important messages of how evidence-based public health solutions can save lives in our community, country, and world through this pandemic, along with injury prevention. So thank you for taking the hard work and dedication to make our community safer and healthier during this rapidly changing pandemic. We are very appreciative both of the support from the CDC for our funding, as well as the institutional support of U of M that makes our center and this conference possible and thriving. Early indications show that many of the injury areas that we are working on are reporting increased morbidity and mortality during this pandemic, making our work only more urgent and important, even though the pandemic distracts us in all aspects of our lives. I recognize how difficult the situation is for everyone here today in the communities in which we work, and so that please know that I and the Injury Prevention Center support and applaud your ongoing efforts. Research studies have forced to pause or adapt to new guidelines, programs, and services during these times, such as for teen driving, naloxone, and opioid services. Some prevention services had to be forced to shut down completely. Staff had to be redeployed, and we will continue to adapt. But yet, as the increased stress and economic instability and loneliness can have detrimental effects on youth violence, ACEs, suicide, and many other injury areas, our researchers will continue to persevere and to learn through this time. Now more than ever, it's important to continue our evidence-based prevention work. These are difficult and complicated times. I really miss being in person. I miss the side conversations that we would be having this morning over coffee. I miss seeing you all today. And I know that through science, we will be together again in times in the future. So please enjoy today's symposium. Thank you, Dr. Carter, Dr. Walton, and Jessica Roche, and enjoy your day.
Thank you, Dr. Cunningham. It's my pleasure to be the moderator for the first half of the morning. I'll be introducing our panel of speakers and moderating the QA portion. As a reminder, most of our Flash Science presentations for the morning were pre-recorded, but we'll be conducting a live Q&A after each of the sessions with the speaker. So please submit any questions you have during the speaker presentations in the Q&A box on the screen, and we will ask them at the end of their presentation, time permitting.